Hi, thanks for joining. My name is Vicky Castillo, and I am the CEO and founder of FACETS Healthcare Training. We are a CNA test prep that is national and state specific. I'm also a nurse. I often get asked questions. What is a CNA? What does a CNA do? Where do they work? And how much do they get paid? So I thought I'd do this video to address some of those questions. So let's get started with the first one. What is a CNA? A CNA is the abbreviation for Certified Nursing Assistant or Certified Nurse Aide. The terms are used interchangeably. A CNA is an individual who has taken a state-approved nursing assistant course and then passed both parts of the state certification exam. An individual who is taking the course is referred to as a nursing assistant student or a nurse aide student. And upon completing the course, the person no longer uses the term student, but rather nursing assistant or nurse aide. Only after, and this is important, only after a person passes both parts of the state certification exam can they call themselves a CNA, a certified nursing assistant or certified nurse aide. To do so before then is incorrect, but more important, fraudulent, and can lead to regulatory violations. This is also another important point. A CNA is not a nurse. This is important because saying so violates laws intended to protect the public and can lead to felony charges. There are also variations to CNA terms such as LNA, Licensed Nursing Assistant, or STNA, State Tested Nurse Aides. You may also see others, but essentially they are terms that are describing the CNA with variations in job duties. The next topic is, what does a CNA do? A CNA assists an individual with basic care, described as activities of daily living or abbreviated ADLs. Examples of ADLs are eating, bathing in showers, getting dressed, mobility, incontinence care, and toileting. There are additional CNA duties that are described in the scope of practice for each state. So what one state may allow a CNA to do may not be allowed in another state. So it's important to be familiar with each state's scope of practice. Where do CNAs work? Many places are commonly known, but others are not. CNAs work in nursing homes, skilled nursing facilities, rehabilitation centers, detention centers, hospitals, and I want to take a minute here and talk a little bit more about the areas in hospitals where they work. CNAs work in hospital med-surg floors or medical surgical floors, telemetry floors, labor and delivery, postpartum, perioperative care, and they work with both adults and pediatrics. They also work in home health. They work in hospice, both doing home hospice visits and inpatient units. They work in outpatient clinics, surgical centers, and mental health and behavioral health centers, and private duty care as well. With additional training, CNAs can become certified medication aides or patient care technicians or emergency room technicians, and some nursing schools require CNA as a prerequisite, and there may be some other jobs that also require CNA as a prerequisite. So be sure to do your due diligence. How much do CNAs get paid? Starting pay is average about $13 to $15 per hour. However, pay varies greatly depending on experience, work area, whether it's part-time or full-time position, whether it's benefited or unbenefited, whether a person's going to work Monday through Friday or are they just going to work weekends. Weekends tends to pay a little bit higher. Also, if the person is working for an employment agency, that will result in a higher wage compared to working for one organization. And recently, there's been a high demand for CNAs doing travel assignments, which also yields a high pay. And of course, Pay will depend on your negotiation skills. Hope this helps to clarify CNA information and misconceptions. And remember, there's a critical shortage of CNAs. So there's a high demand, lots of work available out there with many opportunities for advancement. Thanks for listening.